Welcome back to the special holiday edition of Health Matters. I'm Dr. Mark Castellaw with Baptist Medical Group. Hospital pastoral care departments have a number of duties. One of them is providing a way for patients, employees, and visitors in the hospital to celebrate the holidays if they can't attend church or family gatherings. Joining me now is Reverend Anthony Burdick, Baptist Memorial Healthcare's System Director of Pastoral Care. He'll tell us how he and his colleagues tend to patients, visitors, employees' spiritual needs during the holidays. Welcome to the show.
Good to see you.
And Merry Christmas.
Well, Merry Christmas to you.
Now, the holidays are such a wonderful time and everyone's having fun and everything, but there are those that hurt during the holidays. They've lost loved ones, or heaven forbid, they're in the hospital during the holidays. So how does the pastoral care department at Baptist address these needs?
Well, we recognize the fact that, as you just alluded to, absolutely no one really would want to be in the hospital over the holidays. And so we try to do things as much as possible to provide a normal celebration for folks for their holidays. One of the first things you'll see at our facilities is, especially in the metro area, are life-size nativity scenes set up either inside or out on the front lawn of our hospitals to remind folks about Christ and the reason for the celebration at this time of the year. So we do simple things like that. We understand the dynamics, the spiritual and emotional dynamics that people are dealing with when they're stranded in the hospital over the holidays. Many of those folks are not just dealing with their own issues, but as you mentioned, they're dealing with grief issues, the loss of a loved one. That's particularly difficult at the holidays.
Now, also during the holidays, there's some people that may succumb to bouts of depression as well during this time because of instances they may have associated Christmas with. How do you deal with those?
Well, Baptist has a number of resources at our disposal. One of those things is the bereavement center at the Trinity Hospice House. The services that they offer and the resources that we can use there for referral purposes really are wonderful to help folks during the holidays. The folks at the Bereavement Center at Trinity provide educational opportunities for folks ahead of the holidays. The chaplains at the hospital will also be cognizant of that and help people deal with the things that they can anticipate having to go through at the holidays, especially if it's a first or second set of holidays without a loved one.
What is some of the words of encouragement and comfort that you give patients and family members that might be suffering during this time?
Well, first of all, we're always going to remind them of the hope that they have in our Lord, and point them to scriptural passages that would reinforce that hope. Then on the more practical side, I guess, and that's probably not even the best choice of words, but on another side, we're going to try to listen to what they're going through. And one of the things I've found helpful for a lot of folks is just to reassure them that they're not going crazy. The feelings that they're experiencing.
That it's okay to feel that way.
And they're discovering a new normal as they go into the holidays without a loved one. A lot of folks expect things to be just like it always was, or they force that upon themselves. And we try to help folks remember, give yourself the permission to do things differently this year. If you need to set aside some traditions, you can always add them back in later on if you want to, but give yourself permission to feel what you're feeling and work through this time, and don't overload yourself during the holidays.
And that's oftentimes part of the whole problem is you got so much going on as well, and then when you add this, sometimes it's just too much.
Yeah, I can remember when my mom died, my dad felt like it was his responsibility to pick up all the things that she used to do during the holidays, and we had to come in and tell him, Dad, that's okay.
That's not necessary. That's great advice.
Just do your thing, and we're going to help us all get through this together.
Well, thank you so much for being here today. Next in my Health Matters memo, more on healthy holidays, plus a special tribute to members of the Baptist Medical Group family. Stay tuned.